Contessa, the World Health Organization has declared the coronavirus outbreak a public health emergency of international concern. They are saying they are doing this not because they don't have confidence in the way China is responding to this outbreak, but because of the concern that it could spread to countries with weaker healthcare systems. Remember, they met for 2 days last week and declined to declare this that public health emergency of international concern. And now they are doing so after seeing the broader spread. And again, as they say, they are worried it could spread to countries that aren't as well prepared to deal with it. Now we are waiting to hear whether they make any recommendations in regards to travel and trade. What this declaration allows the WHO to do is gives it further purview to make those kinds of recommendations internationally. So we will wait to hear those. And I'm hearing we do have the sound of them making the declaration. Listen to what the WHO Director General said.
Of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it. Let me be.
So that's the Director General, Dr. Tedros Ghebreyesus, there saying again this is not because of China's response. And he actually went out of his way to commend China, saying they may even be setting a new standard for outbreak response, guys. But we are getting that public health emergency of international concern declaration for this novel coronavirus.
First, we have an update on the spread of the deadly coronavirus. Now, a short time ago, the World Health Organization declared the outbreak an international public health emergency. The organization's Director General explains why they've taken this step.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it.
Well, the virus has now spread mainly in China, with more than 8,000 confirmed infections there, at least 170 deaths. But it has touched many other parts of the world. And the number of coronavirus infections has just surpassed the number of infections in the SARS epidemic, which hit in the early 2000s. In mainland China alone, the coronavirus cases have outpaced SARS' global total, although right now the death rate is much lower. Let's take a look at how quickly the virus has spread. Just last Friday, there were only 941 global cases confirmed. Now, less than a week later, that's jumped nearly 9 times higher, and the numbers are still rising. Well, meanwhile, the Centers for Disease Control and Prevention have just confirmed the first case of human-to-human transmission here in the United States. Well, I want to take a closer look at this right now with our Chief Medical Correspondent, Dr. Sanjay Gupta. Good to have you here with us to break this all down. So the World Health Organization says it's making this declaration not because of China, but because of other countries affected by this. Just practically, what does this declaration mean?
Well, and the other countries that are affected by this, there are many of them, but in at least 5 other countries besides China, you're now seeing human-to-human transmission. Last time the World Health Organization met, they said, yeah, we acknowledge this is an emergency in China. Let's wait and see what happens in the rest of the world. And now we see it. And so there's evidence of spread, and there's evidence that that spread will grow. What this is not, this public health emergency, is not more funding, really. You know, it's not more financial resources necessarily, although it may be a redistribution of resources, especially to countries that need it, you know, developing countries where they may have a harder time taking care of an emerging outbreak like this. It also, I think, sends a signal how important this is to the world, and may impact trade, may impact travel in terms of what these countries are going to do to try and mitigate the outbreak. We're seeing some of that already, obviously.
Exactly,
the biggest quarantine in history right now taking place in China. There's been these travel restrictions out of China. So you're seeing some of that. I think you're going to see that more amplified now as a result of this declaration.
Yeah, exactly. 60 million people in China already facing travel restrictions, which is significant. And the WHO initially were reluctant to declare this a public health emergency because they were worried about the economic implications. They were worried people would cancel their business trips and their holidays. But clearly they now must think that the benefit of doing this outweighs that risk.
That's exactly right. I mean, I think that was the reason they were hesitant to do this before. It's a big deal. And by the way, these declarations, they didn't exist before SARS. Right. SARS sort of made the World Health Organization realize they needed some sort of body and some sort of declaration like this to be able to handle it. So you've had, H1N1, Ebola, Zika, things like that. So this is another public health emergency. And I think that the idea that you're going to be able to signal to these countries what is appropriate in terms of travel and trade is very much part of this. It's going to have an impact. It's going to have an impact on these economies for sure.
There's no doubt about it, and it already no doubt is in China.
Right.
But in terms of how this virus compares to other respiratory illnesses, it seems right now, at least from the figures we're getting in, and we might not be getting the full picture, but from the figures we've got, it seems like the death rate is much lower than a lot of other respiratory illnesses.
Absolutely, and this is sort of one of those things where in public health, I think there's always this belief, or this concern rather, that could this be something that spirals into a large lethal pandemic, like what happened in 1919, what happened in 1969. There's not evidence of that right now. In fact, the death rate, as you mentioned, is lower than we saw with SARS. There's probably lots of people, I think, Linda, even within China, maybe other parts of the world, that may be carrying this virus now and have no idea because they either have no or minimal symptoms. So as that number of infected grows, without the number of deaths growing correspondingly, the fatality rate comes down even further. So it's bad news in that it's spreading, but good news in the sense that it may not be as serious an illness in the vast majority of people. That's something that we'd want to see.
Yeah, exactly, and let's hope for that. Dr. Sanjay Gupta, as always, thank you for joining us. Appreciate it. You will indeed. Thank you.
Back in Wuhan, social media shows how some residents keep moving inside their own homes, finding normalcy within the lockdown. But a look outside, and you're reminded life here is anything but normal. David Culver, CNN, Beijing.
Well, Hong Kong is trying to stem the spread of the virus. High-speed trains connecting the city to mainland China were closed Thursday. And some border crossings were also shut down. Travel restrictions imposed on tourists coming from the mainland. Well, global airlines are also partially or fully suspending flights as well to China. Hong Kong was hit hard by the SARS virus back in the early 2000s, and citizens are now taking no chances with this virus.
As the coronavirus continues to spread globally, the Centers for Disease Control and Prevention announcing Thursday the first human-to-human coronavirus transmission in the U.S. between two patients in Illinois. Today, the World Health Organization declaring a global health emergency. There are now more than 7,700 confirmed cases worldwide, the death toll climbing to 170 in China, where cases are now confirmed in every province and 20 countries around the world. American families evacuated from the virus epicenter in China, some paying thousands for charter flights back to the United States.
When we first stepped on board, my jaw dropped. I've never seen a plane set up like that before. It was a wide open cargo plane, but had passenger seats in it. It felt like something out of a movie.
Nearly 200 Americans now under quarantine at a California base.
We're hoping to get back home this weekend.
Blood samples, throat and nose swab cultures taken from every passenger sent to the CDC headquarters for testing. The White House announcing President Trump has formed a task force meeting daily to lead the American response. But where some see alarm over the potentially deadly virus, Commerce Secretary Wilbur Ross sees an opportunity.
I think it will help to accelerate the return of jobs to North America, some to U.S., probably some to Mexico as well.
Several airlines have scaled back flights to and from China, and the White House is even considering suspending all flights from China until the virus is under control. Trevor Ault, ABC News, New York.
Answering the call for help, medical teams from North China leaving for Wuhan and Hubei province, the epicenter of the outbreak of the novel coronavirus. None of them knowing what they will face when they get there, nor how long they will have to stay. And late this afternoon, the World Health Organization issued this warning.
The whole world needs to be on alert now. The whole world needs to take action and be ready for any cases that come, either from the original epicenter or from other epicenters that become established.
Wuhan and surrounding cities remain in virtual lockdown, villagers even barricading themselves against a virus that does not respect borders. And the WHO has also announced that tomorrow it will reconvene its committee to decide if this is a public health emergency of international concern that would trigger an international response. But the team, who has just returned from China, praised the country for its handling of this outbreak.
The fact that to date we have only seen 68 cases outside China and no deaths is due in no small part to the extraordinary steps the government has taken to prevent the export of cases. For that, China deserves our gratitude and respect. And they're doing that at the expense of their economy and other factors.
There is no end in sight, though. Confirmed cases are now just under 6,000, more than the number in China infected during the SARS outbreak in the early 2000s. The death toll has also risen to 132. And now airlifts of foreigners from Hubei province have begun. 4 passengers on the evacuation flight to Japan had coughs and fevers, and 2 were diagnosed with pneumonia, although it's not confirmed that they have coronavirus. Tomorrow, Britons who want to leave will be flown out, but wives or partners with Chinese passports will have to remain behind. And those who do return will be put into quarantine for 14 days, the incubation period for the virus.
Good evening, and it's great to have you with us here on a Thursday night. And we begin with that new case, the first human-to-human case of the coronavirus here in the U.S. A couple in Chicago, the woman just back from China, and her husband now has it. It comes as the World Health Organization tonight has now declared the outbreak a global health emergency after a 10-fold jump in cases in just a week. And in a sign authorities are taking this very seriously, a cruise ship has been quarantined in an Italian harbor. 7,000 people on board were waiting to find out whether a sick passenger from China had the coronavirus. And those Americans who had been evacuated from China, we showed you the pictures last night to that military base in California. They have now learned that if any of them tests positive for the virus, they'll all be quarantined for 2 weeks. ABC's Steve Osunsami leads us off. He's outside the CDC in Atlanta tonight.
As health officials were declaring a global emergency today, this was the scene outside pharmacies across Asia, where they were running out of face masks and people are desperate to protect themselves. Here in the U.S., what authorities have been predicting for more than a week has happened in Chicago, the nation's first person-to-person transmission of coronavirus. A man in his 60s got it from his wife. She returned from China January 13th, symptom-free, and felt sick 3 days later. Both husband and wife are hospitalized tonight in isolation.
I recognize that this news may raise people's concern, but I want to state clearly that this development is something we have been prepared for.
Outside China, there are now 98 confirmed cases of people sick with this respiratory disease, and 6 of those cases are here in America. The nearly 200 passengers who landed in California from Wuhan, China Wednesday are learning some disturbing news tonight. If just one of them tests positive for the coronavirus, they all may need to remain in quarantine at this military base for 2 weeks.
Our accommodations here on base?
It's supposed to be voluntary, and they were supposed to be able to leave by Saturday. A passenger who tried to get up and leave today was ordered by authorities to stay. Inside China, an epidemic. More than 8,000 people are sick and more than 170 dead. More cases than the SARS outbreak that swept through that country in 2003. Hundreds of Americans are still stuck there trying to get home.
In Atlanta tonight, and Steve, so many watching this unfold, not only here in the U.S., but around the world. What are the symptoms of coronavirus, and who are authorities saying are most susceptible?
Well, authorities say that the symptoms are fever, cough, and shortness of breath, and they're really paying attention to anyone who has traveled to or from the affected region. But they point out that these symptoms are very similar to the flu, which has been much more deadly. They say in the U.S. this season, more than 8,000 estimated deaths in the U.S. this flu season alone. David?
Steve Osunsami leading us off tonight. Thank you, Stephen.
Hi. Over the past few weeks, we have witnessed the emergence of a previously unknown pathogen, which has escalated into an unprecedented outbreak and which has been met by an unprecedented response. As I have said repeatedly since my return from Beijing, the Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably deaths, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world. The speed with which China detected the outbreak, isolated the virus, sequenced the genome, and shared it with WHO and the world are very impressive and beyond words. So is China's commitment to transparency and to supporting other countries. In many ways, China is actually setting a new standard for outbreak response, and it's not an exaggeration. I also offer my profound respect and thanks to the thousands of brave health professionals and all frontline responders who, in the midst of the Spring Festival, are working 24/7 to treat the sick, save lives, and bring this outbreak under control. Thanks to their efforts, the number of cases in the rest of the world so far has remained relatively small. There are now 98 cases in 18 countries outside China, including 8 cases of human-to-human transmission in 4 countries: Germany, Japan, Vietnam, and the United States of America. So far, we have not seen any deaths outside China, for which we must all be grateful. Although these numbers are still relatively small compared to the numbers of cases in China, we must all act together now to limit further spread. The vast majority of cases outside China have a travel history to Wuhan or contact with someone with a travel history to Wuhan. We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system. We must act now to help countries prepare for that possibility. For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill prepared to deal with it. Let me be clear. This declaration is not a vote of no confidence in China. On the contrary, WHO continues to have a confidence in China's capacity to control the outbreak. I'll repeat this. Let me be clear. This declaration is not a vote of no confidence in China. On the contrary, WHO continues to have confidence in China's capacity to control the outbreak. As you know, I was in China just a few days ago, where I met with President Xi Jinping. I left in absolutely no doubt about China's commitment to transparency and to protecting the world's people. To the people of China and to all of those around the world who have been affected by this outbreak, we want you to know that the world stands with you. We're working diligently with national and international public health partners to bring this outbreak under control as fast as possible. In total, there are now 7,834 confirmed cases, including 7,736 in China, representing almost 99% of all reported cases worldwide. 170 people have lost their lives to this outbreak, all of them in China. We must remember that these are people, not numbers. More important than the declaration of a public health emergency are the committee's recommendations for preventing the spread of the virus and ensuring a measured and evidence-based response. I would like to summarize those recommendations in 7 key areas. First, there is no reason for measures that unnecessarily interfere with international travel and trade. So WHO doesn't recommend limiting transfer or trade and movement. We call on all countries to implement decisions that are evidence-based and consistent. WHO stands ready to provide advice to any country that's considering which measures to take. Second, we must support countries with weaker health systems. Third, accelerate the development of vaccines, therapeutics, and diagnostics. Fourth, combat the spread of rumors and misinformation. Fifth, review preparedness plans, identify gaps, and evaluate the resources needed to identify, isolate, and care for cases and prevent transmission. Sixth, share data, knowledge, and experience with WHO in the world. And seventh, the only way we will defeat this outbreak is for all countries to work together in a spirit of solidarity and cooperation. We're all in this together, and we can only stop it together. This is the time for facts, not fear. This is the time for science, not rumors. This is the time for solidarity, not stigma. I thank you.
Thank you very much, Dr. Tedros. And let's hear from the chair of the Emergency Committee, Professor Hussein.
Thank you very much. So now was the time. Today the Emergency Committee almost unanimously concluded that it was now time to suggest to the DG of WHO that the novel coronavirus outbreak is a public health emergency of international concern. Considering first the increase in the number of cases in China, second, the increase in the number of countries affected with cases, and also that some countries have taken questionable measures concerning travelers. Thanks to the IHR, our main international health treaty, declaring a public health emergency of international concern is likely to facilitate WHO leadership role for public health measures, holding countries to account concerning additional measures they may take regarding travel, trade, quarantine or screening, research efforts, global coordination and anticipation of economic impacts, support to vulnerable states. Declaration of a fake should certainly not be seen as a manifestation of distrust in the Chinese authorities and people, which are doing tremendous efforts on the front line of this outbreak with transparency and, let us hope, with success. Novel coronavirus has placed its crown in several countries. Some are able to try to cope with new cases. For some others, it will be more difficult, and declaration of a public health emergency of international concern should open ways to facilitate this task. The DG just declared the novel coronavirus event as a public health emergency of international concern. For this purpose, the Emergency Committee has formulated advices that could become temporary recommendation concerning WHO, China, and affected or non-affected countries, and this will be detailed in the statement about public health measures, travel, research, international cooperation, and coordination. Thank you.
Thank you very much, Professor Hussin. Now we're opening the floor here in the room for 2 questions, and then we will go online. So then I'll take the first here from the Chinese colleague. Please introduce yourself.
It's Yang with Xinhua News Agency. I got 2 questions for Director General. First one, to your knowledge, what are the most extreme measures that some other countries may execute against China after the release of the decision? And how will WHO respond to these drastic measures? And secondly, as many countries are stepping up to work on the vaccine, so what kind of role can WHO play in coordinating international efforts to work and develop the vaccine? And is there a specific timeline for the development of the vaccine? Thank you.
Thank you.
As I said it earlier, we should have actually expressed our respect and gratitude to China for what it's doing. It has already done incredible things to limit the transmission of the virus to other countries. And where respect is due, then you don't punish. Meaning, if anyone is thinking about taking measures, it's going to be wrong. And WHO doesn't recommend and actually opposes any restrictions for travel and trade or other measures against China. On the vaccine, we have already started, and we have invited relevant partners, and there is progress, and we will inform you as soon as we have detailed information.
Thank you. And I'll take a second question from the room. Associated Press, please. And down right now to the table.
Just down on the table.
Thank you.
Sorry.
Can you hear me? Hi, this is Jamie from Associated Press. Dr. Tedros, thank you very much. 2 quick questions. One is, I'm not quite sure about the travel recommendations. It sounds like you and Dr. Hussin are saying different things. The WHO is not recommending a travel recommendation, but that countries themselves should be allowed to. So how does that all fit together? Because as you know, there are a lot of countries that are already reacting. And then the second question just has to do with your visit to Xi Jinping. And I just want to make sure that we understand when the last time that a DG like you flew to a country to meet with the head of state during an evolving outbreak to request more detailed data and permission. Why was that necessary? And if China was responding efficiently and transparency, if China was responding transparently and efficiency, why was that necessary? Thank you.
Thank you very much, Jamie, Dr. Tedros, and possibly also Professor Hussin, but maybe you want to first start with Dr. Tedros.
Yeah, I would be happy to give the travel. We don't recommend travel or trade restrictions as WHO. And what I said and what Professor Hussin said are actually the same. But I would be glad if Professor also can comment on that. And on my trip to China, I have done it to other countries too before. So, going to the field, visiting countries, having first-hand information is very important. And that's why I had to visit to see for myself what's happening. And I came back so impressed I have never seen in my life this kind of mobilization. And maybe you're following the one hospital which was being built in 10 days. Big hospital. But that's not the only thing. You know the measures they're taking, which I believe will reverse the tide. And going there and witnessing that is very important. Witnessing how the leadership is leading the response is very important. And the other impressive part is it's the president himself who is leading this effort. And when we arrived, the day we arrived, the Prime Minister was actually in Wuhan. And all the ministers are involved, relevant ministers. This is impressive. And witnessing that kind of leadership and interacting with those leaders who are leading an outbreak personally can get me a real experience for me too, and actually a learning experience. And because of that, I actually recommended to other countries globally to have that kind of political commitment and leadership at the highest level possible. And when that happens, I know things happen on the ground too. So I think visiting China was a very important one, which is not a new one. Of course, I did it many times to other countries where there was outbreaks and so on. This one was special because I was able to learn many things from what China is doing. And I'm very confident by what they're doing. I have seen the capacity, and I believe that they will control this outbreak as soon as possible. They have all the capacity that needs. But not only what they're doing is protecting their people, but I know from the figures also, you know that it's protecting the rest of the world. Outside China, we only have 98 cases and no deaths. If strong measures were not taken in China, this would not have happened. And that's why I also said we have to appreciate what China is doing. And this declaration is not actually because China is not doing what it can. It's actually doing more than China is required to do. This is to protect especially countries with weaker health system and to prepare for that. And for your information, during my discussion with the President and other officials, they're willing to support countries with weaker health systems with whatever is possible. I think that is why I said in my speech earlier, in many ways, China is actually setting a new standard for outbreak response. Thank you.
Thank you very much, Dr. Tedros, and looking at Professor Hussain for your comments on travel and trade recommendations.
What does it mean, a travel restriction? It means, for example, visa refusal, border closure, a quarantine of travelers who are in good condition. These travel restrictions, under the declaration of a public health emergency of international concern, this declaration will provide to WHO the possibility to question such measures, which already have been taken by some countries. Why did you take this decision? Why? What is the science supporting this decision? Could you reconsider this decision? And we suggested to WHO that WHO should inform the world about transparency concerning these measures, which should not constitute an example to follow, but a decision to reconsider.
Thank you very much, Professor Hussain. With this, we'll turn towards our journalist colleagues on the line. By the way, we have more than 150 online right now. I'm looking at Radio France for the first question, and then we will go to Science, Kai Kupferschmidt. So Radio France, please, first.
Oui, bonjour, Jérémy Lange pour Radio France. Une question peut-être pour le Docteur Roussin. Être plus précis peut-être sur les évacuations. Parmi les mesures que vous jugez néfastes qui ont été prises par certains pays, votre opinion précise sur les évacuations et sur la fermeture de certaines liaisons entre les pays occidentaux et la Chine. Je voudrais avoir votre commentaire là-dessus. Est-ce que vous pensez que c'est là aussi des mesures qui sont pas nécessaires et qui sont néfastes?
Merci bien, but could you please repeat for the journalists in the room and our listeners your question in English? Thank you.
Oh, of course. The question was about the evacuation that was taken from certain countries, among them France. Do you consider that it is an unnecessary measure, and also the fact that some countries, again France, like you have no direct flights now from Air France from Paris to China. Do you consider those measures unnecessary too?
Thank you.
Well, the evacuations from the citizens of some countries who are presently in the Hubei province, they are measures that some countries are able to take because they have the capacity to do it, logistically speaking. They also are the proof of some confidence in the capacity they have then to avoid contamination from these persons once they have returned in their national state. So this is why it is a measure that some countries are able to take, but clearly not all countries can do that. It's probably a situation which is a little bit exceptional. This is the only thing I can say about that.
Thank you very much. I hope this answers your question. With this, we turn to Science Magazine. Kai Kupferschmidt, please.
Thanks. This is probably for Tedros. So I'm curious. I mean, we've seen this in the Ebola outbreak in West Africa as well. That countries, take these unilateral decisions to close borders or refuse visa and things like that. Other than questioning them, about the evidence base for this, are you doing anything, in the background to actually change this, or specifically also, British Airways or Air France flights? Is there anything that you can actually do as WHO to change this?
Dr. Tedros, please.
I think we will do everything so people can do the right things. With the flights, we may not be able to convince them because some of the airlines actually said that they're not flying. It's not because of the virus, because they don't have enough passengers. And that could be a reason, and it will be very difficult if that's the case. Otherwise, we engage, and through this declaration, by the way, through the recommendations, we expect that they will follow that, but at the same time we will continue to engage. Thank you.
Thank you very much, gentlemen and ladies on the panel. With this, we reached the end of our press briefing. Everybody, thank you very much to all the many listeners online and to the large crowd here in the room. I thank the panel. Thank you all very much. For everybody, we will be sending the audio files very shortly after this, together with the statement and the intervention by Dr. Tedros, and sometime later maybe also video clips, and for the transcript we will most likely only send in the course of tomorrow. Thank you all very much. Have a good evening.
Thank you.